Most people who walk into our clinic say the same thing in the first 5 minutes. They tell me they want something done, but they're terrified of looking done. I'm Dr Mahmoon Rashid, the treating clinician at Skinfinity. In the next 10 minutes, I want to show you how a doctor-led clinic thinks about aging well, what we treat, what we don't, and why we'd rather you left looking like a slightly fresher version of yourself than someone you don't want to recognize in the mirror. So one of the things that we don't do in clinic is try to create that overdone effect. There's so many times I see patients coming in who have had treatments before where they've got an overprojection of cheeks or they've got overprojected lips. What we really try and do here is actually respect the facial features and current proportions and work with them to get patients to have that natural looking effect that really comes across as being so subtle that patients themselves are the ones who really recognize what's been done, and restoring that natural beauty is really the essence of the clinic. Being CQC registered is such advantage to our clinic here. We have regulations that we have to uphold. You know, that for patients gives them the safety of coming to a clinic where we adhere to certain standards, and that's reflected in the way that we practice too. The tools that we're using more commonly now in clinic are more about biostimulation, and they can be various number of treatments. The most common treatments are Sunakos, for example. We've also got polynucleotides. We've recently started to use Julane, which is an absolutely phenomenal product. And in addition to that, we also have other treatments in place to help restore that natural result without the overlooked effect that you will get from some treatments. So where I won't treat is when you get patients coming in who are already overprojected. A great example is someone who's already got lips that are outside of the normal proportions for their face and they want more volume. For me, I've got a responsibility as a clinician to kind of just park it and just say, I don't think this is right for you. However, this could be more suitable. You get patients coming in wanting overprojected cheeks and it just doesn't fit their profile balance. You'll get patients coming in wanting to look like a certain celebrity and they may look completely different too. Everyone's got natural proportions that you can work with, but trying to create something out of the ordinary is sometimes beyond limits really, and very difficult to do in non-surgical aesthetics. And also you get this very fake looking and puffy looking appearance by trying to go and chase that sort of goal for patients too. Patients will normally have like a long-term treatment plan. So that can be starting off by using treatments to help improve skin. So that can include a course of peels. It could also involve prescription-based retinol. Once we've got the skin to a certain standard, what we can then start doing is using biostimulators such as Sunakos to start stimulating certain types of healthy collagen to really improve that hydration and elasticity in the skin. And we can also then start using treatments such as Julane to try and get even more sort of stimulation of healthier collagen to try and help with that gentle, subtle lift and tightening in the skin. If you've been put off aesthetics because every result you see looks overdone, that's the version of this work we don't do either. Come for a consultation. If it's not the right thing for you, we'll tell you.